This year, an estimated 70,000 Canadians will have hip or knee replacement surgery to regain their lives of movement. Research shows, and most healthcare professionals would agree, that the more you know about your surgery and your role in your return to mobility, the better your results will be. In hip and knee replacements especially, the patient plays a critical role in the preparation for and recovery from orthopedic surgery. This three-part video series is designed to help you learn about your journey through the orthopedic care path and how you can be an active participant in your regained mobility.
While following surgery, patients need to focus on their comfort, healing, and recovery. In the first few days to weeks, it's very important to follow directions given by the healthcare team, the nurses, the physiotherapists, and the surgeon to ensure that the wound heals well and that there is minimal pain and discomfort. So you need to take your medications, you need to take any other prescriptions to reduce risks such as a blood clot, and to comply with the rehab instructions to get the best possible outcome.
The biggest concern post-surgery for me was how long would it take and would I reach the goal for getting the flexion and extension I needed to have a fully functional knee. When I was going through my recovery after surgery, one of the things I realized quickly is that I had to recognize what pain was normal pain and what pain was pain caused because I was actually hurting the joint or it was causing more problems. So once I was able to do that, the normal pain is just scar tissue being stretched, and it's a gradual pain that develops as you push harder and harder. The other one is a sharp pain, a pain that hurts right away and it feels like somebody's sort of sticking a needle into you kind of pain, and that I learned very quickly you don't push through and you don't work against.
Typically 10 days to 2 weeks after your surgery, you'll see your surgeon or your family physician to have your staples or sutures removed and check that the wound is healing properly and that you don't have any questions. After that visit, you'll begin to see the surgeon less often, and a checkup visit may be booked at anywhere from 4 to 8 weeks after surgery. And then 6 months later, you'll see the surgeon again to check up on your progress, and finally about a year later, you'll see the surgeon again, and on occasions, you'll see the surgeon more frequently. Generally, most patients' first question is, when can I return to my usual activities? While my skill as a surgeon is very important to replace the bothersome joint as skillfully and appropriately as possible, a patient's own motivation and willingness to recover as quickly as possible is the most important factor in a speedy recovery. It is extremely important for patients to work really hard to facilitate the recovery and to improve their rehabilitation. Unfortunately, with any operation, there's a fair bit of pain after surgery, and it's very easy for patients to say, I'm having a lot of pain, I can't really participate with the exercises because they're worsening the pain. But it's crucial that they work through the pain, take their painkillers, use things like ice to assist them in improving the pain so that they can work on their recovery. In addition, they might equate that the loss of pain as the pain improves equals full recovery, but that is not necessarily the case, and they may have to persist with their exercises until they've achieved their full recovery. And let's face it, an exercise program in physiotherapy is work, and most of us have better things to do than to suffer through exercises, but it's absolutely crucial that these be complied with to achieve the best recovery. Patients should gradually increase their activities and continue with their exercise program to achieve the maximum potential that they can with their operation. It's also critical to note that very early on in the recovery process, the gains can be fairly large. However, later on, you'll be experiencing very small gains, and if you don't continue with your exercise program, you may not achieve those little gains that will allow you to achieve your best ultimate potential.
What was important was that I knew I had exercises to follow, and I knew you had to follow them to a T, and I did. I had to do exercises 3 times a day. I did them 3 times a day at home. But on top of that, I also had a physiotherapist that followed me, and I would go to see her 3 times a week, and I did everything that she had asked me to do, and then go home and redo them again.
When I was recovering, I did most of mine at home. I was fortunate to have a wife that was an orthopedic nurse, so she was able to assist me. I bought all the equipment myself. Not that there was a lot, there was only a ball and a tubing, and I bought a goniometer, which is a tool for measuring the knee. And so for me, I did everything at home, and I had one goal in mind. That was every day I had to improve by 1 degree. The key to successful knee surgery is the physical therapy that you do every day. And it has to start immediately, right away. As quickly as possible, you should be trying to move that leg as much as possible. That's painful, but without it, you won't get the degree of flexion and extension, which is critical to have a fully functioning knee. If you only get 90 degrees, you will have difficulty getting up from a regular chair. But if you get your 120 and up, which most people can get if they push through the pain, then you can pretty much do anything you wish to do. Since I've had the operation now, I don't have pain in my left knee, and it's actually compensated. My right knee was quite sore and no longer is, because now I walk normally. I can do anything I would choose to do. I avoid activities that are high impact or could cause injury, just because I don't want to ever have to go through that again if I don't have to. But I can do pretty much anything I want to do athletically, or even, around the house in the yard.
My new knee felt like it had never felt before. My knee had been bad for years and years, and to finally be able to walk around and without having any kind of problem was wonderful for me. So it gave me a new lease on life, basically. I could get up and down stairs. I had not been able to walk upstairs or downstairs for the longest time. I would avoid a curb. I would walk a long way so I didn't have to step up a curb. Now I could step up a curb. Prior to the surgery, I heard someone say, oh, it'll take a year before you can really get back. But it depends on your muscle tone, how well you are working that muscle in order to get better quicker.
When you're getting ready for your surgery, learn as much as you can about the process. Find out about the recovery. Try and understand the different pain levels so that you're prepared to fight through the stretching kind of pain, because that is the key, is your ability to overcome what feels like I can't do this. You have to make yourself believe absolutely you can, because everybody else is doing it. And if they can do it, you can do it. And if you can do that, you'll be successful in getting the flexion and extension you need.
If in doubt about what to expect, it's important to talk to your surgeon or to talk to a fellow patient who had a similar operation. You can contact these patients through the Canadian Orthopaedic Foundation's Peer Connect program, also known as Ortho Connect, and that can be invaluable in getting some insight as to what to expect with the operation.